You cut your finger, you reach for a plaster, you barely think about it. The solution is always right there. You get an infection, you take an antibiotic. That antibiotic probably took less than a minute to obtain, and it will work in days. 1,000 years ago, a small cut could kill you. A broken bone often meant a death sentence. And yet, ancient humans survived. They hunted, they fought, they fell from cliffs, they were injured constantly, and somehow many of them healed. Ancient skeletons show evidence of healed fractures, healed infections, healed surgery. So how? What did ancient humans actually do when they were hurt? The answer is far more sophisticated than most people expect. The answer will change the way you think about medicine forever. Because ancient medicine was not guesswork, it was knowledge.
In the ancient world, injury was everywhere. Sharp flint tools, animal claws, rival groups, falls on rocky ground. Every day brought new opportunities to be seriously hurt. A deep cut could become infected within hours. Before antibiotics, even healthy, strong people died from infected cuts. Without treatment, infection could spread to the blood, and then it was usually fatal. Ancient humans knew this from bitter experience. Every generation learned the cost of neglecting wounds. Every group had lost people to wounds that looked minor at first. A thorn scratch, a small cut from a flint blade, a blister that burst. So they learned, and what they learned was remarkable. Passed down from healer to healer, generation to generation for hundreds of thousands of years.
The first medicines were plants, and ancient humans knew which plants worked, long before anyone wrote it down. Yarrow, one of the most ancient wound plants on Earth. It stops bleeding, it fights infection. It has been used for at least 50,000 years. Neanderthals were buried with yarrow pollen at Shanidar Cave 60,000 years ago. They were placing healing plants with their dead. They knew what these plants could do. Willow bark, the original painkiller. Humans have been chewing willow bark for pain relief for at least 50,000 years. It contains psilocin, the compound we later turned into aspirin. Honey, packed with hydrogen peroxide and antimicrobial compounds, it creates an environment where bacteria simply cannot grow. Ancient Egyptians used it on wounds, but humans were using it long before Egypt existed. Mud from certain soils, clay, charcoal, leaves, bark, moss. Activated charcoal absorbs toxins. Certain clays kill bacteria. These are not myths. All of these had real chemical properties that helped wounds heal. Nature had been building a pharmacy for millions of years. Ancient humans found it.
But plants were only the beginning. Ancient humans also performed surgery. Deliberate, planned, skilled intervention. Not accident, not ritual, surgery. Real surgery on living people, tens of thousands of years ago. Not ritual, not ceremony, actual surgical intervention to save a life. The oldest evidence of surgery is a leg amputation performed 50,000 years ago, found in Borneo. The patient survived. They lived for years afterwards. This was not an accident. Someone planned this operation and carried it out. The bone had healed cleanly, no sign of infection. Someone cleaned the wound, controlled the bleeding, kept it free of infection. Someone had the knowledge and the skill to do this 50,000 years ago. They understood anatomy. They understood infection. They understood how to keep a patient alive. Trepanation, drilling a hole in the skull, done at least 10,000 years ago. It was used to relieve pressure on the brain after head injuries. Many patients survived. Their skulls show the bone growing back around the hole. In some sites, over half the trepanation patients lived. That is a remarkable survival rate. But surgery and plants were only part of the picture.
Ancient humans also understood something modern medicine sometimes forgets, that the patient is not just a body. They are a person who needs comfort and belonging, that healing requires rest, community, care. The injured were not abandoned. They were looked after. This is one of the oldest human behaviors we can prove. The evidence is clear. Ancient skeletons show people who survived serious injuries only because others helped them. Without group care, they would have died. With it, they lived for decades. A skeleton from Shanidar Cave shows a man with a withered arm, a blind eye, and severe arthritis. He was in his 40s. In the ancient world, that alone was remarkable. He survived for decades. He could not have done it alone. Someone fed him, protected him, stayed with him through his recovery. Ancient humans looked after their sick and injured. They always did. Care and compassion are not modern inventions. They are ancient instincts. We have always looked after each other. It is as old as being human. Ancient healers also understood things we are only rediscovering now. They knew that clean water helps wounds heal. They knew that covering a wound protected it. They knew that keeping a patient warm helped recovery. Body temperature matters for healing. They knew this before anyone wrote it down. They knew that certain plants reduced swelling and pain. Turmeric, used for thousands of years as an anti-inflammatory, is now confirmed by clinical trials. They knew that infected wounds needed to be drained. None of this was accidental. It was accumulated knowledge passed down for generations. Every healer learned from the one before. Every generation added to the store of knowledge. Ancient healers were not guessing, they were practicing. Medicine as a skill, as a craft, as a calling.
Here is the twist. We tend to think of ancient medicine as primitive, superstitious, ineffective. We picture painted faces and drums and meaningless rituals, witch doctors, chants, useless herbs. But modern science keeps confirming what ancient healers already knew. Yarrow, proven antimicrobial. Willow bark, proven analgesic. Honey, proven antibacterial. These were not lucky guesses. They were the result of thousands of years of careful observation. Turmeric, garlic, aloe vera, all used for thousands of years, all scientifically validated today. Ancient humans were not lucky. They were observant. They paid attention to what helped and what didn't. That is the foundation of medicine. They watched, they tested, they remembered what worked. Across generations, this built a body of medical knowledge that saved countless lives. That is not superstition, that is science. Ancient medicine and modern medicine are not opposites. They are the same thing at different stages. The first healers were not witches or shamans performing magic. They were doctors, working with what they had and doing it remarkably well. The first doctors in human history deserve our respect. They worked without textbooks, without labs, without any of the tools we take for granted, and they saved lives, again and again, for hundreds of thousands of years. Subscribe. Every day we dig up one piece of the ancient human story.